Thanks for joining us here on Litter Media. I'm Dan Ramey. Coming up in just a moment, an update from the Ross County Health District. But first, this from Hometown Motors Incorporated, 818 Eastern Avenue in Chillicothe.
The fleet of American-made stand-ons from Wright Manufacturing, built by landscapers for landscapers. Available now at Hometown Motors Incorporated, 818 Eastern Avenue, Chillicothe.
We're joined now by Kelly Dennis and Ben Avery from the Ross County Health District. Gentlemen, thank you for joining us. And Ben, last time you and I talked, we were discussing with Dr. Brown about the potential for reopening Ohio. The governor had his initial plans released yesterday, and now the scramble is on, is it not?
Yeah, it has been somewhat of a whirlwind here. The information has come out pretty quickly, and I think we all got it at the same time. So we're just in the process of kind of digesting what the new plan is and figuring a new communication plan in terms of getting that out to local businesses such that they can open up at the target time, but in a safe manner and one that's well thought out.
I think that's the big concern. The quick critics are ones to say, oh, it's too early and you don't have a plan. Well, it has been laid out there for us, and many of us have been conditioned to start doing some things. So I think we've got to a point where it's almost second nature for some of us now to wear the mask and be cautious as we're out and about.
Yeah, the decision to open up, I think, was a very difficult one that the governor spent a lot of time deliberating. He heard opinions from those that are more health-minded and some that are more economy-minded, and he had to find a balance and make a tough decision based on all the evidence that he could gather from the experts. And so this is the plan that he's selected on, and as governor of the state of Ohio, this is really, I believe, his decision as to when to do this. This is not a health department decision, but we are supportive of our governor and our state, and we're going to do everything that we can to help this, next phase, per se, of this pandemic open as safely as possible and with as much information as possible that we can get out there. So.
And really, that's where now Kelly comes into play in the information sector here. And Kelly, tell us what you've done with rosscountyhealth.org to let people see what they need to learn.
Yeah, well, that's one of our goals, is to communicate information as quickly and as accurately as possible. So we do that through several means. We do it through our Facebook page. We do it through social media, and we do it through our website, which is rosscountyhealth.org. One thing we want to lead people to is, we want to make sure they're aware of what's happening. So we post our case numbers and our statistics on our main, but we also wanted to make sure businesses had access to the information released by the governor. So that's all put on our webpage. We've got several different links on there to where you can get to the information, both on our website and then also links to coronavirus.ohio.gov. But most importantly, those are the directives that are issued by the state. The governor mentioned yesterday, we've got 88 counties in Ohio and 117 something health districts. So we had to do this uniformly. So that was kind of the idea, is statewide orders will allow health departments to spend the time on planning and preparation for these orders rather than having to come up with them on their own. So it's nice that we have that in place, that the state provides these resources for us, and then we are there to communicate it to the public. So go to our website, you get the information, and then also, we can communicate that information to our stakeholders and our businesses as needed.
You both participated in a virtual meeting earlier today with the Chillicothe Chamber of Commerce, and a number of business folks were on there. What was the response like? What was your initial take on everything?
I thought that they were, attentive. They had some really good questions. Some of them we were able to answer, and others we weren't. I think Kelly did a pretty good job, I think, going through the material that the governor had provided about, the guiding principles and, those types of things. So I think we answered a lot of questions as we went through, but we left with a number of items to research and get back to the Chamber of Commerce with a little bit more clarity. Kelly?
I think anything, Kelly, people who maybe not have been to your website originally
Yeah.
know exactly where to go to get that information, huh?
Yeah, that we take any opportunity we can get to communicate some of our resources, and when we present to groups and organizations, and we try to lead them to those methods of communication. We are a smaller health district. Sometimes the information people need, they need it now, they need it right now to make their decisions, and so we try to push it out on those platforms to make it available 24 hours a day, and then we try to update it routinely so it is up to date and frequent.
Ben, one of the things yesterday that the governor had mentioned in his news conference was about the health departments getting some assistance through employment. I know until you get that in your hands and see the people become reality, it's good news, but you still have to forge ahead until that actually comes to fruition, don't you?
Yeah, I think two of the biggest public health measures that we have to kind of assist us in this transition back to open economy is going to be contact tracing and then testing, expanded testing. So the governor has committed to helping the health district build their bench of contact tracers. I think I heard estimates on his press conference today that he would like to see 15 contact tracers per 100,000 population. So here in Ross County, what would that be, around 8 or 9 contact tracers doing nothing but calling people that have tested positive and identifying their contacts and then issuing instructions to those contacts to isolate. I think that's one of the main things that's going to help us keep this virus from spreading once we end the stay-at-home practices that we've been so diligently following. And I think the other is just wide-scale testing so that we know if we are infected with the virus and know to isolate ourselves. So those are two things I think that the governor is really working on, and certainly providing us with some financial assistance, not only to help with contact tracing, but also to assist our businesses in terms of compliance and education would be very, very helpful. So we're holding our breath and hoping to see that come through sooner than later, because the health district really does. It carries a significant burden under this new structure that the governor's proposing.
What are some of the concerns that you have as we open back up? Everyone's really concerned about it spiking, and next thing you know, people getting too comfortable and not practicing the washing of hands and social distancing and wearing the masks. And you and I talked not long ago about how the awkwardness of only being able to read each other's eyes when you wear a mask, how that makes it difficult when you're in a business operating.
I'll answer, and then I'll let Kelly answer as well, because I think this is a good question. I'd be interested to hear what he has to say as well. I think the business community is really concerned that we open back up and it doesn't go as well as we had hoped. We start to see those cases kind of climb a little bit more quickly than what we're comfortable with, and that we have to slow down again. So going too fast out of the gates and having too much interaction could be a problem. I think a couple other things that I'm personally, will have my eye on is the availability of, simple things like hand sanitizers and masks for people to wear when they do go back into public. And I don't think we can do this responsibly without at least having masks on and keeping ourselves from transmitting the illness. I guess those are two things that I'll be paying attention to as we go forward. Kelly, what do you think?
Yeah, that's the things that you're always in public health. You're concerned about is within the infectious diseases. once you get it under control, you want to keep it under control. And there can be little things that happen that cause, small outbreaks. And then also, it can also lead to, we know this virus can spread very quickly. We want to make sure people are informed, continue to take these precautions, for an extended amount of time. That way it doesn't come back in that, in that surge that's going to put us back to where we are. Those are our biggest concerns. We're planning a lot around communication. We're planning a lot around preparedness, preparing our businesses, preparing the workforces on dealing with issues, but also implementing these measures that the governor's wanting all of Ohioans to do, and that's use face coverings and wash your hands, keep your distancing when you're going out in businesses. These are all things that we're going to continue to communicate, not just in the next 2 or 3 weeks, but it's going to be for the long haul. So, we want people to listen. We want people to take these precautions seriously, and it's going to continue for quite a while.
All right, so we've got a business who has not been considered essential. They've been closed for some time now, and now it's time for them to reopen. Well, where does the health district come into play with making sure that they are following the guidelines that have been placed out by the governor?
I think this is going to be kind of self-directed compliance at this point, Dan. The health department just simply isn't large enough to explore every plan of every business that's about to open up. But we are here to certainly to provide consultation. Like Kelly said, a lot of that information can be obtained by visiting our website, so you don't necessarily have to call. I think it's incumbent upon the businesses to do some research. I think understand the provision of the information that the governor's put out for those businesses that are about to start up. And they need to put together a plan and show how they're going to be able to open and operate safely, for that matter. So at that point, if they have questions, they're more than welcome to reach out to us, and we'd be happy to help them out. But we just ask that you put together that first effort and do the research and work through your planning process. And then if you have additional questions, we're there to help.
I know that yesterday, in listening to the governor and the lieutenant governor both speak, as John Houston had stepped in a couple of times in the last handful of days, really, they're not suggesting you go back to work unless you feel like you safely can go back to work. And if you are a shop owner and a restaurant owner, whatever the case may be for the business is concerned, you no doubt want to take care of your employees first, and then the customers, all in that first fell swoop, don't you?
Yeah. Kelly, you want to take this?
Yeah, that was something we wanted to communicate during the chamber meeting today, is definitely take care of your employees, and putting these precautions in place will protect your workforce, hopefully protect the workforce to the point where they'll be there. If you lose a lot of employees due to illness in a small amount of time, that's really going to put an impact on your business and your capabilities of that business. So putting those measures in place, protecting your workforce, and then ultimately that will go on to protect the customers.
I know a lot of people are anxious for the restaurant industry to get back to being able to open their doors, but I know a number of businesses have signs on their door, no more than this amount of customers in the store at any one time. That's something they have to kind of police on their own too, isn't it?
Yeah, they're going to have to look at, what's the usable area in their store, and going to have to make a reasonable, basically establish a reasonable occupancy rate based on that usable space. Right now, the governor's saying no more than 50% of your normal occupancy level, but other places may have to look at that a little bit more in depth, even than just cutting it in half. I think that's a maximum, is 50% of the normal occupancy rate. There are stores that have a lot more displays and unused areas or unusable areas that it may even be less than 50% when you look at that usable area. So we're here to help folks figure out what a good level is as well. Once they've had a chance to look into it.
Yeah, we certainly know that people have been chomping at the bit. There's no question there. Krispy Kreme, a new system bakery, they're opening pretty soon to be able to do some things they've not been able to do here for, almost a month in some respects, maybe longer. Again, proceed with extreme caution if you were a business owner, correct?
Yeah, absolutely, Dan.
Anything that we have not touched on here today you want to make sure we visit before we wrap up?
Kelly?
No, I think just continue to check our webpage and our social media to keep up on the up-to-date information. I would assume the governor's going to be pushing out a lot of information the rest of the week on his plan. So just keep up to date. Check our website, check coronavirus.ohio.gov, and get your information there.
I think the governor is going to be opening things back up similarly as he closed them down in a layered fashion. So what we're looking at here initially in May is manufacturing and distribution facilities is the first layer that's going to be lifted, but many of the businesses still remain closed. And then, he'll start opening up layer by layer and kind of looking at the data and seeing how it's going and using that data to kind of inform the next step. So that's what I think we can expect as we go forward here in May. And we're just going to be watching really closely and trying to do this as safely as humanly possible.
Well, we're certainly thinking about you folks as we have talked here today. You've got 36 confirmed cases here in Ross County that you're dealing with, and that's a lot of contacts you have to make right there. Cannot imagine what folks in Pickaway County are going through right now.
Well, I've heard that they're looking at testing the entire population of the Pickaway County Correctional Facility. So if that's the case, all the counties surrounding the facility is going to see their numbers increase. So we'll also be paying attention to that as we go forward and doing the contact tracing as necessary.
And as we have focused on these dates for manufacturing to open up and retail businesses and all, the potential for the swabs and testing kits, all of that to increase in that same fashion, that's going to be a big positive, I think.
Yeah, the governor's indicating that he expects to really be able to ramp up testing in the month of May, and that'll be a really big compliment to our efforts here in public health. Certainly looking forward to that. It could even potentially shorten the quarantine time for some of those folks that we've asked to quarantine. So increased testing would be greatly appreciated and very helpful.
Well, each second that passes with each day, we're getting closer. So we appreciate your efforts and continue to give you hats off to each and every one of you that are in this fight. And we appreciate your time today, and we'll check again soon.
Thanks, Dan. We appreciate it.
It's been Avery and Kelly Dennis and Kelly's baby in the background there, too. So thanks again, guys. We'll talk to you soon.
Thanks, Dan.